Individualized medicine is the future of medicine.
Mitochondria is like the thing to look at when you're dealing with anti-aging.
One of the most exciting fields that I'm involved in as a preventive cardiologist is focusing on this genetic cholesterol called lipoprotein A.
So what are PEMF therapies? How do they relate to aging and longevity?
Hyperbaric oxygen has been used for a long time with head trauma, and we know that head trauma can be a risk for dementia.
There's so many researchers that are focused on this, and so much science being published on it is using plant medicine.
So one of the keys to sustainable healthcare is actually having the proper body charge.
Breath holding practices also have a huge variety of benefits.
For men, we actually are able to utilize PRP to heal erectile dysfunction.
Welcome to another bonus episode devoted to helping you become ageless. My name is Stefan, and as usual, I'll present this very last bonus episode 12 of the Ageless docuseries. Time flies quickly, and it probably seems like you just started watching this series only a moment ago. It just proves how rapidly lives goes by, and we have to make the most out of every moment. I hope you got as much value as possible from our Ageless docuseries. But what if Ageless was just the first step in living the best decades of your life? Today you can go a step further by joining our video streaming platform Zonia, where you'll find more than 1,000 action-packed videos that will guide you through building your ageless sanctuary. And today is your absolute last chance to get on-demand access to all 12 episodes of Ageless on Zonia. Because once the free screening of this final bonus episode is over, if you decide to join Zonia on a later date, the Ageless series will not be there anymore. It will be gone. And before we dive into this final bonus episode, I have one big last-minute surprise for you and everyone else who is right now watching this bonus episode of Ageless. We have decided to add over $2,763 worth of free essential bonuses to our Zonia platform for everyone who joins Zonia during this free screening of this bonus episode only. And as a special bonus during this limited viewing, if you choose the annual Zonia plan, you'll also receive our all-natural herbal longevity and detox supplement bundle worth $158 for absolutely free. That's one bottle of our Restore Life longevity formula and one bottle of our Restore Detox supplement as a gift to you. And this is in addition to having on-demand access to all original episodes of Ageless, plus over 1,000 health bite-sized short videos on Zonia. So I'd love to tell you more about each one of these bonuses. First, when you join Zonia today for as low as 50 cents a day, you'll get downloadable PDF transcripts and MP3 audios of all 10 original episodes of Ageless, so you can read or listen offline each episode anytime and anywhere you want. You also get access to uncensored bonus episodes 11 and 12 of Ageless, revealing many innovative therapies and groundbreaking regenerative treatments for optimal health and peak energy. You'll receive on-demand video access to both bonus episodes as well as downloadable PDF transcripts and MP3 audios of both episodes. Plus, you'll get 50 full-length, uncut, uncensored interviews with all 50 doctors and health experts of our Ageless series. You'll receive on-demand video access to all of them, plus again downloadable PDF transcripts and MP3 audios of all interviews. You'll also get 3 longevity interviews with 3 healthy non-Nigerians and their secrets. Lastly, you'll get over $1,500 worth of extra free bonuses from our trusted health partners. When you get your hands on these amazing action plans, you'll learn how to improve your hormone function and regain your resilience. You'll discover holistic options to prevent cognitive decline and proven secrets on how to experience peak brain power, energy, moods, skin, and so much more. And in addition to everything I just mentioned that's included in this bonus package, if you choose the annual Zonia plan today, you'll also get one bottle of our Restore Life longevity supplement, plus 1 bottle of our Restore Detox supplement that are valued at $158 for free. Our Restore Life supplement is a fast-acting body rejuvenation formula with the power of only 7 natural ingredients that you have heard mentioned many times by our experts: berberine, fisetin, organic matcha green tea, turmeric, transresveratrol, vitamin D3 and vitamin K2. Restore Life's action is complemented by our Restore Detox supplement. It contains 6 science-backed natural ingredients: NAC, citrus pectin, selenium, dandelion root, milk thistle and artichoke leaf extract that are proven to help flush out dangerous toxins and promote a long-lasting full-body detoxification that's essential for longevity. I mean, only the retail price of these 2 bottles is more than the price of the annual plan for Zonia, and you're getting them for free with everything else I just mentioned. So it's really a no-brainer. Zonia is the perfect complementary resource to the Ageless docuseries. If our episodes showed you the what and why, Zonia will show you the how. We've included over 1,000 short videos that present the simple steps for reversing aging in an easy-to-digest 5 to 7 minute video format. Simply choose your favorite topic and get started at your own pace whenever and wherever you want. We've also made access to everything incredibly affordable, as low as 50 cents a day and 100% risk-free for the next 7 days. So if you're the type of person who likes to take action, today is the very last day you can get all the benefits of Zonia, plus all 12 episodes of the Ageless docuseries and all the extra bonuses for an extremely low investment. However, a friendly reminder that once the free screening of this final bonus episode is over, if you decide to join Zonia on a later date, the Ageless docuseries will not be there anymore and it will be gone. And you'll also lose the chance to get over $2,763 worth of free essential bonuses. And let me tell you, you'll not find any of our health videos anywhere on the internet. Click the button below to join Zonia and begin your healing and longevity journey today. Now, let's go back to this exclusive bonus episode 12 of Ageless. After receiving so much positive feedback, we decided to share even more innovative rejuvenating therapies that are backed by extensive medical research. In the next part, you'll hear about the surprising inventions of our doctors, the miraculous drug for longevity that's not a pill, and how one morning activity can extend your life. Let's dive into it.
Some of my latest research has to do with cell energy. And what I've discovered, and this is something that comes up very often in clinic, people say, why me? Why am I sick? I was in the room with someone else too. I got sick and they didn't. Why is that? Why is it that I could eat a hamburger and gain a pound and you could eat a hamburger and you either lose weight or don't gain any weight at all? Why me and why now? That's a big question that many people ask. And what I've discovered just recently is that our bodies are actually like electric circuit boards. Most of us understand that our body is the neurological system is sparked by little frequencies that go from nerve to nerve, and that's how we transmit information from the brain down through the spine to all the different organs and for us to function properly. Well, it turns out there's a pretty famous doctor, one of the original guys, pioneers in energy medicine, Dr. Jerry Tennant, and I had an opportunity to be with him about a month ago. I had private study work masterclass together. And he discovered that there's certain voltage that every cell has to have in order for it to thrive. So one of the keys to sustainable healthcare is actually having the proper body charge. Guess which way, or one way we can get that from natural sunlight, particularly from infrared frequencies. So there is a clear connection between his body of work and my body of work. It turns out that you need 25 millivolts of electricity to sustain a cell. You need 50 millivolts in order for you to repair a cell. And so the biggest reason why people have chronic ailment and sustainable chronic ailment is they don't have enough power to support their immune systems to actually fight back. The latest research and the latest generation that I will be bringing forward is going to be technology that will actually allow the body to get more body energy through sunlight, through some of the technology that we've already developed. One thing that we have developed is what we call a tri-light system. It's a special LED bulb that actually has 3 wavelengths. Mostly LEDs, light-emitting diodes, are monochromatic. They only have 1 frequency per bulb. When I looked at the physics behind that, it's really just an industry norm. There's no real physics why that has to be. So we actually developed a diode that has 3 wavelengths in it, and they're hand-picked wavelengths because what they do is they energize the body. And so I think, again, like grounding, like infrared sauna, harnessing this particular concept of supporting body cell energy is going to be super important now and moving forward.
I'm a huge fan of sauna therapy. Sauna is absolutely amazing for many, many reasons. We have incredible research showing huge reductions in neurodegenerative diseases, huge reductions in heart disease, and most importantly, huge reductions in all-cause mortality, the risk of dying from any cause associated with sauna use. And it is a direct dose-dependent curve. The more frequently you use the sauna and the longer duration you use it, the more reduction you get in your risk of those diseases and all-cause mortality. And the effect is very robust. We're talking about massive 60+% reductions in all-cause mortality. If there was any drug that could do that, this would be hailed as a miracle drug. Every doctor would be prescribing it. They would say it's the most amazing longevity-enhancing thing in the world, and you're crazy if you're not taking it. Well, that drug exists, but it's not in the form of a pill from a pharmaceutical company. It's a sauna. So saunas are absolutely incredible, and the benefits go on far beyond that, enhancing athletic performance, detoxification, improving brain health, fighting depression. The list is much greater than that. So the huge variety of benefits from sauna exposure. In addition to that, we also have other types of hormetic stressors. Things like breath holding practices, or what's called in the literature intermittent hypoxic training. And breath holding practices also have a huge variety of benefits. In fact, there's even research now linking this type of hormetic stress with reduced incidence and severity of COVID-19 infection. So upper respiratory tract infections. If we build our upper respiratory tract adaptations through challenging that system through breath holds, we can stimulate unique adaptations in this cardiorespiratory part of the system that are different from the adaptations that we might get from sauna or from cold or from other types of exercise. Certainly things like weight training. By doing that, we get all kinds of really amazing special benefits. For example, one of the benefits that we get from breath hold practices in particular is a physical restructuring of the interface between our alveoli, the little air sacs in our lungs, and the capillaries around them. So the body actually physically restructures that interface to allow gas exchange to occur more easily, to allow oxygen to get in the blood more easily and carbon dioxide to be dropped off. In addition to that, now at the cellular level, the interface between the capillaries, the tiny blood vessels that are delivering blood to the cell, and the cell itself also creates an adaptation of that structural interface to enhance oxygen delivery to the cell. And the third layer is that at the mitochondrial level, there is also structural adaptations. We get this stimulation of mitochondrial biogenesis to grow bigger, stronger mitochondria, to create more mitochondria, and you get unique adaptations that make the mitochondria uniquely efficient at utilizing oxygen to produce energy, and simultaneously more tolerant of low oxygen states, what's called ischemia or hypoxia. And those states often occur in many different illnesses and many different stressors. And as a result of that, you can make your cells and your mitochondria more resilient, more resistant to damage from that type of stress. One other type of hormetic stress is called xenohormetins or xenohormetic stress. And these are from plant phytochemicals. And these are often called in the scientific literature exercise mimetics, because it turns out that some of these phytochemicals from plant foods actually mimic some of the same physiological pathways, hormetic pathways, that exercise does. Don't get too carried away because they're not a replacement for doing the types of exercise that I mentioned before, but they are a great addition to it because they do amplify those pathways, and they're a great way of continuing to stimulate them while you're not doing exercise. Now, some of these compounds are things like curcumin from turmeric or resveratrol from red wine or grapes. Many other different compounds in a variety of different foods. Cruciferous vegetables have sulforaphane, which is a very powerful xenohermetic stressor. Tea, and green tea in particular, has high levels of EGCG, which is another powerful stimulator of mitochondrial growth and biogenesis by stimulating these hormetic pathways. And the list goes on. There are dozens, actually hundreds or thousands of these different types of plant phytochemicals found typically in colorful plant foods, things like purple cabbage, purple sweet potatoes, blueberries, blackberries. All of these have anthocyanins and flavonoids and polyphenols and other types of plant phytochemicals that act as these xenohermetic stressors that stimulate mitochondria. So if you're interested in living a long life, the single most important thing that I can recommend to you is have a daily hormetic stress practice. First thing in the morning, implement one or another type of hormetic stress, and you can potentially layer multiple types together. For example, you can go in your sauna and you can do breath holding practices while you're in your sauna. You can combine exercise with sun exposure. You can combine fasting with exercise. You can combine phytochemicals with other types of hormetic stress. And by doing this, by having a practice of experimentation and layering in multiple types of hormetic stressors into your life and into your lifestyle, and committing to a daily morning practice of hormetic stress, this is, in my opinion, one of the most essential and the most powerful ways to extend your health span and extend your lifespan.
These were just a few examples of proven solutions that our experts use on a daily basis. We have a lot more coming though, and this will really change your perspective on longevity and healthy aging. Some of the therapies we're about to cover are still not widely known, despite achieving great results. They can significantly regenerate your body without the need for a procedure, which is a major breakthrough. I know this sounds too optimistic, but please stay with us for a few more minutes. You'll be amazed.
When it comes to the field of regenerative medicine, there are a few different things that we can use to actually heal your body. One of them is something called PRP. PRP stands for platelet-rich plasma. This is a product that we get from your own blood in just a simple blood draw. The amount that we take is only about 1/10 of what you'd give in a blood donation, so a relatively small amount, but still enough for us to work with in a very meaningful way. The cool thing about PRP is that we can do almost anything with it. Because all we're doing is simply taking something that's already existing in your own blood and concentrating it, we can apply it almost anywhere in the body. So we can use it as a topical for face, and we can actually do some microneedling, and we can get rid of fine lines and we can get rid of wrinkles. We can actually use it as an injection to various joints, which is phenomenal for healing things like small tears, mild degrees of arthritis, and of course we can also use PRP for sexual dysfunction. This is for men and women. So for women, the most common things that we end up treating with PRP are things like the reduced ability to actually create lubrication. Sometimes women have pain with intercourse, and we can actually even use it to just bring volume back to the area. Sometimes women do experience a loss of volume in their labia after childbirth, or even horseback riding for a chronic period of time can all lead to that. For men, we actually are able to utilize PRP to heal erectile dysfunction. Yes, it involves needles in places that you wouldn't necessarily like to have needles, but we do take a really great amount of care to make sure that there's adequate numbing and the smallest possible needles are used, so it's a relatively comfortable experience. And what we actually get to see is that the PRP heals, right? This is because it is the concentration of all of the healing factors that are present in your blood and then expanded when we put them in the centrifuge. So we can get a 10 to 100x concentration of all the things that matter to initiate a healing cycle, and we can apply them wherever we need to apply it. The other cool thing about this is that the healing that you get is yours to keep. And this is how I love to explain regenerative medicine to people, is that it's not a Band-Aid, it's not a pill, it's not something that's just gonna go away. The example I like to use is if you've ever had a cut on your arm, a scrape on your knee, some other injury that's happened to you, and it healed up. That thing's not just gonna reopen a year or two later. The healing that you got was yours to keep. Same thing with regenerative medicine. One of the other cool tools that we like to use in regenerative medicine is stem cell therapy. Currently in the United States, there's a couple ways that we can get stem cells for clinical practice. A lot of people are familiar with stem cells when it comes to cancer treatment, namely the stem cells that we get from a person's bone marrow and how they can be used for things like leukemia. The type of stem cells that are used in that are ones called hematopoietic stem cells. Big word, basically what that means is that they are in charge of blood-forming cell lines. We don't usually like to use a lot of those in clinical practice for things like musculoskeletal issues, but they still can be. The things that we like to use in clinical practice are actually the mesenchymal stem cells. Again, another big word. And the word mesenchymal actually comes from another word, meso. And the meso word is actually related to how we develop as a baby in our mommy's belly. And it's a type of cell line that is created. This cell line actually gives rise to your bone, your muscle, your cartilage, your nerve tissue, and even your fat tissue. Well, these are all the juicy things that we like to fix when it comes to musculoskeletal issues in the body. So using those mesenchymal stem cells for those applications, similar ones to PRP, such as tears in the shoulder, arthritis in the hips, arthritis in the knees, even disc issues in the back, we see phenomenal results across the board. People get off their pain medications, people see actual changes on their MRIs when they get them done 6 months later, and of course we get function and quality of life back. You know, everyone from athletes who don't want to lose a season of their career to grandparents who just want to play with their grandkids. This type of healing is available to everybody who, is of course a good candidate for it. And there really is only a few people that wouldn't be a good candidate for it. Namely, the people that wouldn't be a good candidate for this are people who have active cancer, people who are taking certain medications, things like dexamethasone, cortisone, prednisone, and other ones too. And of course, people who are smokers. People who are smokers do not do well with regenerative therapies because a lot of regenerative medicine banks on the idea of angiogenesis. Angiogenesis is how the body creates new blood flow and new blood vessels to bring more nutrients and healing to an area. Smokers notoriously do that very, very poorly, simply because of how the poisons in the cigarettes just completely kill their cardiovascular system. We actually used to think that we had to utilize a chemical called mannitol in order to actually get stem cells to cross into the brain. Well, we realized that's not actually true. The crazy thing about mannitol is that it's actually really not safe, right? We give this to a patient and its whole goal is to drop the blood-brain barrier, which means anything can get in, right? We don't know. And that can also change how the pressure of the fluid in the brain is registered, which isn't always a good thing for the patient. We actually have new research that shows us that it is actually not necessary to give this to patients at all. And what you can do is just simply deliver stem cells intravenously. And what they're able to do is kind of go right up to the blood-brain barrier, and they can read what's happening on the other side. They can pick up on the inflammatory signaling that's coming off of the other end, decide what they need to do, and release something called an exosome across the blood-brain barrier, because they're very, very tiny messenger packets, and that will actually carry out the actions that the stem cells deem are necessary. So we know now that we can actually get really meaningful results in a lot of neurodegenerative issues by simply just utilizing stem cells. Another tool that we can use in the regenerative medicine field are actual tissues that are left over from birth. Back in the 90s, there was a lot of stuff happening as far as conversations regarding, oh my goodness, stem cells are coming from these aborted fetal cell lines and these embryos. And it became kind of a hot topic for a lot of people. And there's still a lot of misinformation out there regarding, well, where are stem cells actually coming from in this day and age? And truthfully, in the United States, none of them are coming from questionable sources. There is the ability to utilize birth tissue that has been procured from full-term live births under very, very stringent guidelines and testing, moms that have been followed throughout their whole pregnancy, copious amounts of testing, very, very strict standards, and of course, no moms or babies are harmed during that harvest. But we don't also want to let these tissues go to waste. We know that the amniotic fluid, the actual placenta, and of course the umbilical cord are very rich sources of not only stem cells, but other regenerative cells too. So what these places do is these labs will collect this tissue and then create products that physicians can buy and deliver to their patients. What's amazing about these is that you are getting day 0 old regenerative factors. So piles of growth factors, cytokines, and even stem cells that you can use to regenerate almost any part of the body in a really meaningful way. Why this is important for the field is that this actually saves the patient from having to get a procedure done if they don't want one. Because of course, if we're taking stem cells from a patient's own body, we have to likely get them from inside the bone marrow or from their own fat tissue. And some patients just don't want to have to deal with the procedure. And for those that don't, we do have these birth tissues as a really viable alternative to, of course, having to do a harvester surgery.
As far as the types of therapies a patient would be likely to come across for regenerative medicine, the 3 main ones are going to be PRP, which stands for platelet-rich plasma, prolotherapy, and then stem cell therapy. For PRP, or platelet-rich plasma, the philosophy behind this is we're going to take your own platelets and use that to affect repair in, say, your knee joint or a shoulder. You have a rotator cuff injury or any joints in the body, low back as well. Platelets are the cells in your blood that cause clotting. So, you get a cut on your arm, you start to bleed, platelets show up in the cut, form a clot, and you stop bleeding. They also have regenerative capabilities. The actual mechanism here is they secrete both anti-inflammatory factors, which are going to help reduce pain, and they secrete growth factors as well, which is how they're going to help repair and regenerate the areas that we're attempting to treat. So basically what we do is we have a patient come in, we take a little bit of their blood, we centrifuge it in our lab, and that will separate their blood into distinct layers. At the bottom of the tube or vial, you'll see their red blood cells. On the top, you'll see their liquid plasma. And in the middle, you'll have this thin, whitish layer that we call the buffy coat. The buffy coat is where the platelets are. And so then we'll take the serum plasma on top and the buffy coat and leave the red blood cells behind. And in the example of, say, someone with knee osteoarthritis, we'll inject that directly into the knee, and we expect that to bring down inflammation, therefore pain. The growth factors, we expect to go to work on things like, cartilage cells or chondrocytes, and just help to, fluff up and regenerate and heal the area. I always tell patients, give me about a month, maybe 2, depending if you're, say, a slow responder to where you really start noticing the effects. But oftentimes we'll see patients notice effects long before that. I've had patients, tell me a week and a half after doing their therapy that, like, oh my God, I can run up and down the stairs all I want, and I always have to say, slow down. We don't want to undo the work we just did. Give me at least 4 to 6 weeks of decreased activity. It just goes to illustrate how profound and how significant those effects can be for people, especially, if they've been, again, in the context of knee pain, dealing with knee pain forever and going in and getting steroid shots, which are just kind of a Band-Aid, symptom suppression, kick the can down the road. You'll be back in 6 months, maybe sooner, maybe a little later if you're lucky. And yeah, they just don't actually cause lasting healing. Prolotherapy is another regenerative therapy, very similar to PRP. We'll use it for a lot of the same conditions. For this example, I'll use, let's say, an MCL sprain or a tear in the MCL, or just kind of fraying of the attachments of the MCL to the tibia. So again, we'll see this really commonly in athletes or people who are overweight, where there's just kind of an undue amount of strain on the knee as we age. And so prolotherapy, I would refer to it as a sclerosing therapy. We want to trigger the formation of scar tissue in an area where an attachment of a tendon or ligament is weak to strengthen and tighten up that attachment. So the mechanism here is we're going to inject a solution that is largely composed of sugar and water. The sugar most commonly used is called dextrose, and dextrose, or really any sugar, is irritating when it's outside of the veins. It's not supposed to be there. And so you can feel this kind of burning or soreness when we inject that fluid. And what we're doing here is we are simulating an injury. We're triggering the acute inflammatory process or response of the body to bring attention and healing to the area. This triggers the fibrosis of repair mechanisms that cause the generation of that scar tissue that is ultimately going to tighten up and solidify the attachment of, in this case, the MCL to your tibia. or leg bone. The easiest way to think about stem cell therapy is that it's most easily compared to PRP in that we're going to see a lot of the same secretion of anti-inflammatory or growth factors that we do with PRP, just on a much more wide variety and larger scale. Definitely we would consider stem cell therapy the say the quote-unquote gold standard of going after musculoskeletal conditions, even issues with the nervous system, or just generally degenerative conditions as well. So they're doing a lot of those same things as platelets, but there are some important differences, mainly the variety of factors that are secreted and the amount of factors that are secreted. The stem cells ideally are going to divide in your body and just start to secrete that many more factors. And then the most important point of differentiation is that the stem cell can differentiate itself into any type of cell. It's a precursor cell, where a platelet is going to be a platelet no matter where I inject it until that cell dies. The stem cell can differentiate into a nerve cell, it can differentiate into a muscle cell, it can become whatever it needs to be. Stem cells can migrate in the body to areas of inflammation or tissue damage. I always kind of joke with patients, I could inject them into your foot. Some of them are going to go where I need them to go. Obviously, I don't do that, but it's just kind of to illustrate the point that the stem cells can kind of move independently to where they need to go. Definitely, as far as effects we see, I would say stem cells are superior to PRP, and I will say prolotherapy as well. Unless, in the case of I need to strengthen the attachment of something, I would rely on prolo more than either PRP or stem cells for that. There are several different ways to administer stem cells in the body. Some of the more earlier, a few years ago, and this is still done today, although the FDA isn't. We'll say they're not a fan of this these days, is either adipose or bone marrow-derived stem cells. Adipose is a fancy doctor way of saying fat tissue. So we'll do a basically kind of liposuction procedure to take some fat out of your body, spin that down, and we will isolate mesenchymal stem cells. It's a certain class of stem cells that we might use. The other one would be bone marrow-derived, and this is it's quite barbaric. I essentially need to kind of hammer a large syringe into your hip and draw bone marrow and process that the same way I would do your fat tissue to isolate stem cells, although these stem cells are going to be what we call hematopoietic stem cells. Another version of stem cells would be embryonic stem cells. These are the ones that are going to cause the, we'll say the moral issues when it comes to stem cells. Are there like abortion factories or people just kind of like churning out fetuses to generate embryonic stem cells, because that's where they come from. So we don't use those type of stem cells. The next best would be mesenchymal. So those would be the kind coming from adipose tissue. We will use donor stem cells. So where the bone marrow or adipose derived, we would call those autologous stem cells, meaning from self. The stem cells I like to use, we would call allogeneic, or donor stem cells. And these will be derived mainly from umbilical tissue. So the process is a pregnant woman wants to donate her umbilical cord tissue to a company so they can harvest stem cells for use with patients. So the company will follow the patient throughout the pregnancy, make sure there's no infections or anything that's going to compromise the quality of the stem cells. Woman goes into labor, delivers the baby, everyone's happy, everything goes off without a hitch. And then the company comes in after the fact to take the umbilical cord and use the Wharton's jelly, which is a component in the umbilical cord, to isolate the mesenchymal stem cells. They are found in the highest concentration in that portion of the umbilical cord. They harvest those stem cells, they, again, quality test them, make sure they're alive, make sure there's nothing in there that's gonna compromise the quality, and they have to be minimally manipulated. That's a very important stipulation as per the FDA. So the companies we work with are FDA compliant in that regard. And then they'll send them to us, they'll package it in dry ice because they have to be kept very, very cold, and we'll store it in liquid nitrogen at our office until they're ready for use with the patient.
So in regards to anti-aging, there's some exciting therapies that are out there. I mean, stem cells have been around for a little bit, and we know the regenerative aspect of stem cells, and I've seen some amazing results from that. I mean, I've seen intravenously introducing that and stage 5 kidney disease and reversing, and now this lady does not need dialysis and so forth. So that's been around a little bit. And then this next step, which is really exciting, is peptide therapy. And what are peptides? Well, they're this kind of small little chains of amino acids. So you can consider them, we know what a protein is, and you can consider peptide as a very small protein. and they are signaling molecules, so which means that they affect how every function of the body is taking place. So you can then trigger signaling in regards to the immune system, or inflammatory, or trigger energy production or regeneration. So all these things can be done, and there are a number of different peptides that are really exciting. You have like thymosin alpha-1, you have thymosin beta-4, you have CJC. And so they're really cool ones out there, and we're learning more and more. I mean, the peptide field is still very young, and we're still playing with it. We can inject like BPC 157. You can take that orally and support gut health or regenerate the gut. Or, you know, there are some doctors that use it for people dealing with the long hauler effect. You know, take it orally for the brain fog. Or you can inject it into a joint to stimulate regeneration. So it's a really cool new field that we're all exploring. And then some other things that I'm doing at the center, that's also kind of where we're playing around with these peptide therapies and how we can introduce them, and also speed up the delivery system. And it's called platelet-derived, you know, nanoparticles. And what that is, in essence, is that, you know, we collect the blood from an individual, and then we isolate the platelet. So we create PRP, you know, platelet-rich plasma. And then we use a sonic device, and we bring in then the whatever peptide it is that we're wanting. Let's say thymosin alpha-1, if we want to kind of modulate the immune system, or, you know, antiviral, or whatever aspect, or we want to calm down inflammation in a tumor environment. Then we can then mix that, use a sonic device, and incorporate the thymosin alpha into the platelet particles, and then use a microfiltration device to kind of break those platelets apart to make them even smaller, which allows a much more efficient delivery system to the area where it needs to go. And platelets, we know they move towards areas of inflammation. And areas of inflammation is where we need regeneration, or areas of inflammation is like if you're dealing with cancer. I do a lot of integrative, you know, cancer therapies at my center. It is a very inflammatory microenvironment. So, you know, when you introduce this intravenously or around the environment that you want it to go to, it's then driven by inflammation and move to that area to elicit the response that you're looking for. So some of the things that I think people that are really wanting to optimize health to look into, you know, so some of the things that we do at the center, you know, we use photobiomodulation, which is intravenous, you know, laser therapy to really juice up the mitochondria and their activity. We also have NAD, which is really exciting. All these different type of therapies that really turn on the mitochondria. And mitochondria is like the thing to look at, you know, when you're dealing with anti-aging. So what increases mitochondrial activity? Well, so the light we're talking about, NAD, and then oxygen. I mean, cells need oxygen. So now we have hyperbaric oxygen therapy. You know that when you have a treatment of HBOT, or hyperbaric oxygen therapy, it increases circulation of stem cells by 8 times. Or when we do the photobiomodulation, you know, we shine light, the laser, it can increase the activity of stem cells by 20 times. If you combine that then with like stem cell therapy or with peptide therapy, you're just gonna exponentially increase the impact. And so it's layering these things together that becomes so exciting for regeneration.
It's just amazing how widely applicable these therapies are. And let's face it, many traditional procedures cannot guarantee you lasting results like those recommended by our experts. Another area we wanted to cover in greater detail is genetic testing for prevention. This is a very broad area, as humans have thousands of genes that can mutate. However, there are a few mutations often found in cancer patients. Checking for them can prevent you from hearing the diagnosis when it's too late. If you want to learn more about your genetic predispositions, listen to Steve Ottersberg about the SNP.
SNP is an acronym for single nucleotide polymorphism. And that big word basically is a fancy name for a mutation that you get in your genes. And so the way that human genetics works, we're known as diploid, meaning that we get a set of genes from our mother, we get a set of genes from our father, and we carry those genes with us our entire life. And if our mother gives us a mutation that influences a biochemical pathway, it can either enhance or diminish the function of the pathway. And so if we get the same SNP from our mother that we get from our father, it can double the effect. And so in genetic terms, we would say that that's a homozygous mutation, meaning we got the same mutation from both parents, and typically it has the most profound influence on our biochemistry. So we can test for about 750,000 SNPs in the human genome. There's really only a small handful that really we know the full function of how they influence disease. There's a fingerprint of SNPs that I see a lot in women with cancer. So number one is MTHFR. MTHFR stands for methylene tetrahydrofolate reductase. MTHFR activates dietary folate into 5-methyl tetrahydrofolate, which is the important active form of folate that enables B12 to do its job. And so MTHFR was one of the first well-characterized SNPs in the human genome, and MTHFR has been linked to hundreds of different diseases, but the direct connection with MTHFR and what people really understand is MTHFR directly influences our ability to metabolize dopamine, epinephrine, and estrogen. And so for the work that I do with consulting for doctors on genetic testing, I train them to look for MTHFR as one of the contributors to breast and ovarian cancers or any cancer that is estrogen related. Bio-individualized medicine is the future of medicine. And what I mean by bio-individualized medicine is we're starting with the genetics. You know, I mentioned earlier that we have the ability to test for about 750,000 polymorphisms in the human genome. We call them SNPs, these single nucleotide polymorphisms. And this testing actually became popular because of 23andMe. If you remember, 23andMe came out, 2014, 2015 with these consumer-based tests. And they really brought this idea of next generation sequencing for single nucleotide polymorphisms to the consumer. Before that, we didn't really have access to this. I mean, when you think about the history of 23andMe, when they ran their first 100 tests, I'm just making these numbers up, but I want to give you an idea of how scale influences and how influences the accessibility to these tests. When 23andMe first started out, they were running 100 tests per year. And just as a made up number, they would have to charge $150,000 per test to be able to offer these 100 tests per year. If they offered 1,000 tests per year, the second year, they might be able to bring the cost down to $90,000. Third year, they do 100,000 tests. Now they're going to bring the cost down to $15,000 per test. What they realized is we need to get to 1 million tests, and we're going to lose money to do it. And they were Google, so they could do it. And the brilliance was they said, once we get to 1 million tests, we can then start charging $150 for it. And I think it's about $250 per test now. But imagine if you had to pay $150,000 for this test, how many people would actually do it? Nobody has access to that. There's a small handful of elite biohackers that are going to do that, like Dave Asprey. But 23andMe was largely responsible for bringing these tests to market that give us the ability to do bio-individualized medicine. And so where we start with bio-individualization of medicine, we start with about 250 relatively well-characterized single nucleotide polymorphisms that help us to understand, do people tolerate dairy? So LCT is the gene for lactase. Lactase is the enzyme that breaks down lactose. So if you have polymorphisms in the gene for lactase, you're not likely going to be able to tolerate dairy. So that gives us a little bit of understanding of if somebody says that they're intolerant to dairy and they have LCT gene polymorphisms, well, maybe you need to avoid dairy. There's other reasons why people are intolerant to dairy, so this gives us, a differentiator between are they lactose intolerant or are they allergic. BCMO is the enzyme that converts beta carotene into vitamin A, and this is why I will not hear the term retinol equivalence anymore. Now that we know that there is polymorphisms in the gene for the enzyme that converts beta carotene into vitamin A, you can't tell me that giving beta carotene is right for everybody. And so I think this is one of the most important things that we get in bio-individualized medicine is we know that if people have BCMO SNPs, beta carotene is worthless to them. There are polymorphisms in the transport factors of B12. So if you have polymorphisms in the transport factors for B12, you will likely need more frequent supplementation of B12 than somebody that doesn't have these. Here's one of the crazy things about MTHFR is if you have MTHFR polymorphisms, you probably don't want to do nitrous in your dentist's office as a general anesthetic because you won't recover from that like the general population will. There are a large number of polymorphisms that are associated with drug response. And I think that that's probably one of the most important things in terms of how we bridge, conventional oncology with integrative oncology is, number one, understanding what patients are the most appropriate patients for different therapies based upon their genetic profile. This is something that we're wanting to build in. We're building an individualized medicine data platform so that we can ingest all of this genetic information to give the doctors, some guidelines for if you are, considering giving this patient tamoxifen, here are the pharmacogenomic genes that might give you some clues about are they the proper candidate for tamoxifen and what's the proper, the most appropriate dosing and duration of that treatment. And so to me, bio-individualized medicine starts with genetics. We then look at multiple blood and urine markers to assess, is the treatment working and are we actually, making headway in terms of changing the metabolic state of the patient from that of a disease metabolic state into that of a health metabolic state.
Everyone keeps looking again for the magic bullet, from standard of care approaches to cancer to even the alternative or integrative world. Everyone thinks that there's going to be a protocol that's going to be the magic bullet. And it's disheartening when I tell patients I know it, when I say there's no such thing. But there's also this other side of hopefulness around it that we might not have a single treatment for this, and we might not even affect a cure per se because it's with us always, but you can certainly change the expression of it and the trajectory of it. And so what we do through the methodology that I train physicians in is this concept known as test, assess, address, don't guess. Because even my colleagues who practice beautifully integrative oncology, they tend to put everybody on a protocol. So whether you're a stage 1 breast cancer or a stage 4 pancreatic cancer, everyone's getting the same thing. Maybe they're coming in, they're getting their IV vitamin C, they're doing their HBOT, maybe they're doing some DCA, maybe they're doing some high dose, whatever supplements. And in that, you might have a few people that respond really well and a lot more that don't. No different than standard of care. We always work on kind of that bell-shaped curve. So standard of care gets excited if about 20% of people have a nice response, and they sort of ignore the outliers. In the way we teach is that you can actually get it down so much more clearly of what brought that patient to a cancering space. Because I think of cancer as a noun or a verb, right? So cancer is cancer, right? But when it's just a noun, it's a teacher, it's an opportunity, it's a messenger. When it's a verb, it's a process, and it's something that you can change its trajectory, turn it back into a noun, right? The way we look at this when we do the testing, we can evaluate a whole pile of metrics. We can look at basic labs, your CBC, your CMP, your trifecta, which my patients call the trifecta, which are markers of inflammation like sedimentation rate, LDH, C-reactive protein. Those are going to give us a lot of ideas, along with many other functional testing we can look at. So we can look at microbiome health, we can look at hormonal balance, we can look at epigenetic single nucleotide polymorphisms, we can look at toxicants, we can look at a whole line of things, including blood biopsies, tissue biopsies. So we know exactly what is going on in the patient's biochemistry in that moment. But we also look further than that. We want to look at their chronology. We basically want to look at their life story, because somebody's biography so much dictates their biology and vice versa. I'm a perfect living example of that. But the beauty is that arrow goes both ways. Change your biography, you change your biology. Change your biology, you can change your biography. And we don't want to leave that out of the mix. And so we really want to know the patient. One of the things that drives me crazy is when someone says, oh, I've got a 46-year-old breast cancer patient today. I'm like, no, you don't. You have a 46-year-old woman who has children, who has family, who has a sibling, who has a husband, who has a dog, who is struggling for her very life and happens to be dealing with a cancer diagnosis. That's a very big difference. And when we start to diminish them down into a diagnosis, it becomes easier just to treat a tumor. But when we expand that view to one that includes who they are, who they came from, what experiences that they had in their lives that might have created trauma and created a rift in their biochemistry that pushed them into this cancering place, that's really profound. And patients who have that part of their being acknowledged and inquired about, they blossom. It is incredible when you tap into that. And so when we talk about cancer and longevity, I mean, every single patient that is diagnosed with cancer is looking at how much time do I have. Longevity gets very different in that community than, say, the Dave Aspreys of the world who are like, I want to be 120. Some of these folks are like, I just want 120 more days, right? I mean, that's a very big different perspective. And yet the common denominator, whether you're an influencer or someone fighting for your life, is the health and wealth of your mitochondrial function. And that's where we need to put our attention. And the things that impact it are the obvious, what you're feeding them, what they're being exposed to, but also what thoughts you have, what belief systems you have impact their expression just as much.
There are so many clues that signal the risk of cancer, and we can utilize modern methods of testing to clearly understand our risk. However, sometimes we may catch an abnormality a bit too late. The next expert will introduce a new therapy called pulsed electromagnetic therapy, or PEMF, that helps with quickly healing the body. Listen to this.
So what are PEMF therapies? And how do they relate to aging and longevity? I'll give you an example. I had a spider bite. I didn't even know I had a spider bite. It was on my leg. It was about the size of a quarter, 25-cent piece. And I didn't even know I was bit. I looked down, I had some itching, and there was this big red lesion on my leg. So I used a magnet. In this case, it was not pulse magnetic fields. But I used a magnet, put it on that area, and I was reading on my back porch. 3 hours later, I looked down, gone. Now, as a physician, having worked for 50 years in medicine, I know what a spider bite looks like. Certainly it was a big insect, but a big biting insect or a spider bite. That's probably what it was. Gone in 3 hours. That's impressive. So what is happening? It's healing it now. Normally, a spider bite would last 2 weeks. 1.5 to 2 weeks before it's fully healed, as long as it doesn't get infected. So it's 3 hours. That's amazing. Another example of how magnetic fields can actually help the body and heal the body faster and better is a 3-year-old child. I had a 3-year-old child who cut off the end of her thumb in the door jamb. Okay, she cut off the part of the thumb that had the nail, but it was past the joint. So fortunately, the father called me right after it happened. The surgeons wanted to clean it up and put a skin graft on it. I said, wait a minute. The end of the thumb that got torn off can be a bandage. It can be a Band-Aid. Put it back on. And let's see what happens. 3-year-old child has healing capacity that a 40-year-old doesn't have. Lo and behold, a small portable battery-operated machine, 1.5 to 3 hours a day. That's it. Nothing else. Right? You can see the suture marks. I have pictures in my Power Tools for Health book. So 3 months later, she's regrowing her nail. She regrew the end of her thumb, bone and all. So that's the power of magnetic field therapy. So it's causing the tissues of the body to heal themselves. The elephant in the room is the difference between PEMFs and EMFs. And those of you who are afraid of EMFs, whether it's 5G or Wi-Fi or microwaves, you have a right to be concerned. But EMFs are environmental magnetic fields. That's what my definition of EMFs is. Not electromagnetic fields, it's environmental magnetic fields. And they're designed for communication. They're not designed for healing. And an EMF is transmitted. It's broadcast into space. It goes on essentially forever, right? Radio waves, radar, television waves, microwave towers for your cell phone to operate. That's transmitted into the environment. So they have wavelengths. They go on long distances. And because they have wavelengths, you can have long wavelengths or you can have short wavelengths. Very short wavelengths are absorbed by the body. They don't go all the way through. They're absorbed. And because they're absorbed, they heat. This is what a microwave oven does. It cooks. It heats. Because the wavelengths are very short. But again, they're broadcast into the environment. You don't control what's out there, right? Unless you hide in a cave or, have a lead wall in front of you. So that's EMFs. Very different. They're not designed for healing. PEMFs are designed in a very, very different way. A PEMF happens when a current is flowing through a wire. That could be a copper wire, it could be an aluminum wire, but current is flowing through that wire. And current flows usually based on the power lines. Okay, and that current, as it's flowing, has a pulse to it. It's 50 hertz or 60 hertz, depending on where you live. So every time there's a pulse, you get a magnetic field. So that's called the right-hand rule. My thumb is the line that's carrying the current, and this is the direction the current's flowing in. So every time the current flows like this, a magnetic field pops up, perpendicular to it. So this is called a closed loop. It doesn't go out, it goes out into space in a sense, but it collapses right back down again. And that's what it's doing. It's just constantly pulsing in and out, but it always collapses back on itself. It doesn't keep going into space. It doesn't have a wavelength, right? It's a pulse. And that's a major distinction. And PEMFs are designed for healing. I had an appendectomy for an elective problem for what looked like a little tumor in my appendix. It turned out to be benign. But I had to have an appendectomy, and I had 3 stab wounds, a laparoscopic appendectomy. So how long would I normally take to go back to work? 2 weeks? 4 weeks? So I had my appendectomy at noon on a Friday. As soon as I got home, I put magnets on my stab wounds. Had virtually no pain. There was some discomfort. You could expect that because the tissues have to heal themselves. I accelerated the healing. And if you do magnetic field therapy on a wound, then you're accelerating the healing, but it also makes the wound more resistant to breakdown, to infection. So I was back to work Monday. Now, was I going to be jumping jacks? Was I going to go up and do a trampoline? Was I going to lift 100-pound weights? No, that's stupid. It's still going to take time for that wound to heal, but it was healed well enough for me to be able to go back and function relatively normally. So that's an example of how magnetic fields decrease aging, because if you don't do it fast enough, then all the resources of the body go to where the damage is, which means that there are less resources elsewhere to take care of all the other sort of maintenance needs of the body at that time. And PMFs basically decrease that from happening.
This is probably one of the least talked about ways to decrease aging while also making you more resistant to developing chronic conditions in the future. And if you currently don't have any ongoing health issues, it's a good opportunity to see how healthy your cardiovascular system is. I don't mean checking your blood pressure, I mean a simple blood test recommended by Dr. Joel Kahn, which will give you an idea of how well your arteries are aging. He'll also reveal some concerning data about drugs that significantly increase your risk for cardiovascular disease.
One of the most exciting fields that I'm involved in as a preventive cardiologist is focusing on this genetic cholesterol called lipoprotein A. Simple blood test, 25% of people inherit it from one or both parents. And from birth, it can start to age your arteries and age your aortic valve. Why do only 1% of doctors order it at this time? 100% order a standard cholesterol panel. Why do 1% add on this special cholesterol? Because there's sort of a nihilism. There's no FDA-approved drug right now for lipoprotein A. Statin medication like Lipitor lowers total and LDL cholesterol. It actually raises the opposite direction of what we want, lipoprotein A. So it's a useless approach to lower lipoprotein A. However, it's not therapeutic nihilism. We know lots of things that can lower lipoprotein A right now, but we're at the most exciting time in the history of this field, and I'll tell you about it. But we can use niacin, which is an over-the-counter vitamin B3 that works extremely well to lower lipoprotein A. We can offer hormone replacement therapy to women that are menopausal, lowers lipoprotein A. Ground flaxseed lowers lipoprotein A. CoQ10, amla, the Indian gooseberry, and there's some others out there that can do it. There's controversy if diet has much of a role, so we'll leave diet aside. the pharmaceutical industry has decided that this is a big market. And they're right, it is a big market. So there's at least 3 products right now in clinical trials, major, expensive, billion-dollar clinical trials that are looking very optimistic that within about 3 or 4 years, we're going to have 1, 2, or maybe 3 injectable drugs that will take a person who's had the bypass, the stent, the heart attack due to lipoprotein A, and we'll be able to eliminate it from the bloodstream 90 to 100% effectiveness. So I'm very, very excited that the word is getting out. Check lipoprotein A, find that high-risk patient, and make them aware that there's research studies they should follow. Really exciting is the scientific proof that arterial disease, aging, plaque, the horrible process that can shorten your lifespan, is reversible. Now, I'm not saying if you're 70 years old, we can get your arteries like a 20-year-old, but we can stop and reverse the process, scientifically proven. One pathway is nutrition, and it has been shown in a series of studies using cardiac catheterization, using PET scan imaging of heart blood flow, that even within weeks of eliminating processed food, fast food, soda, most animal products, added saturated fat, added trans fat, basically eating nature out of the garden. The famous studies of Dr. Dean Ornish, Dr. Caldwell Esselstyn, the Pritikin Center, Mr. Nathan Pritikin. Nutrition can eliminate what's called soft non-calcified plaque from arteries. Very exciting. Number 2, we do have pharmacology. We can't throw away prescription drugs. There's clear data that using drugs like statins in people with advanced cardiovascular disease can cause what's called soft plaque to shrink dramatically, converting it to something called hard calcified plaque, which is lower risk. So very selectively, we may have to use aggressive pharmacologic therapy, even though patients don't want to be on drugs. If they've got aging arteries, we've got to discuss it. And then finally, there's quite a bit of other data. There are certain vitamins out there. There's a vitamin called French maritime pine bark, or the trade name is pycnogenol. Exciting data. There's aged garlic. Exciting human data. There's data that infrared sauna may have a role in enhancing cardiovascular outcome and reducing plaque. Very exciting data. Certain vitamins like vitamin K2, MK7. Very exciting data. We always need more. There's a brand new traditional Chinese medicine herbal combination that just got reported to have profound effects. So really, my toolbox is a big toolbox, and I can help anybody stop and start to reverse their arterial age. And really, I see in my clinic, it's amazing. Arterial age 80 in a 60-year-old, 2 years later, their arterial age is 62, 63. Massive improvement in a short time. I am trained in university settings. I am a university professor, and the mantra of my colleagues is GDMT, Guideline Derived Medical Therapy. Basically, you have high blood pressure, here's the 3 prescription drugs you're on. You have high cholesterol, here's the 1 or 2 cholesterol prescription drugs you're on. You have congestive heart failure, here's the 3, 4 drugs. And that can make people better. It doesn't really address the root cause. Almost everything I do in my clinic is natural alternative healing and education. I may do it with some of the drugs. Some people need pharmaceutical agents. You cannot throw that out. Herbal support, actual vitamin support with human data. And I use a lot of products that reverse arterial aging, like French maritime pine bark, like a substance called Centellicum asiatica, like aged garlic, like traditional Chinese medicine herbs. But what nobody realizes, there's human data on reversing artery age with these herbal approaches. So I'm not picking them out of the air, and I'm not guessing. I'm actually seeing results based on wonderful small human studies, and occasionally not so small, 1,000+ patients. So lifestyle is huge. Dental health, sleep health, stress management, any way you can get people to manage their lifestyle, getting their nutrition under control. It's amazing the lack of education for people who've had a heart attack. They've had a bypass, they've had a stroke, and nobody's ever sat down with them and made a food is medicine, food is health, food is disease connection. And getting, they're eating at McDonald's on the way to my office, and I have to break that that habit and that connection. So yes, the alternative approaches are huge, they're powerful, and they certainly can be used in combination with some of the standard medical treatments.
We're slowly starting to get more into niche therapies. A few doctors got really excited to talk about the next therapy on our list. Its unique formula that effectively deals with concussions, even those you may have sustained years ago that you weren't aware of. In addition, this treatment can lower the risk of dementia while supporting optimal cell function. You've got to see how excited our experts were about this one.
There's so many emerging healthcare trends that are coming, and that's part of what I do is try to keep up with those. But one of the ones that's actually starting to catch fire right now is hyperbaric oxygen. When you do hyperbaric oxygen, there's actually two parts of the therapy. One's the pressure and one's the oxygen. And so one of the things that hyperbaric oxygen does is it improves oxygenation to your tissues, which sounds kind of basic, but as you get older, your arteries don't work as well, your small arterioles don't work as well, and you get less oxygen to your skin, to your brain. Just the oxygen tension increase in hyperbaric oxygen improves blood flow there. The other thing is many people don't realize they've had concussions from playing sports. They've had concussions from a car accident. They've had chemical concussions. Did you know that chemicals can induce a concussive-like state in your brain? And one of the things with concussions is that you have this thing called the penumbra. So it's like a big area that has decreased blood flow. The pinpoint is damaged. That whole area is still functional, but it's subfunctional. Well, hyperbaric oxygen increases those cells level and actually makes that smaller. So you can have people who've had a concussion or injury or had a gas event because they were airline stewardess or whatever, and have lost the ability to read or lost the ability to remember things. And hyperbaric oxygen reoxygenates those parts of the brain. Hyperbaric oxygen also activates stem cells, right? We talked about stem cells, exosomes, peptides, all these really cool things. Well, hyperbaric oxygen does that all at the same time. And the other thing about hyperbaric oxygen that a lot of people don't talk about is it affects your microbiome or the bacteria in your gut. So a lot of emerging research is showing gut health affects brain health. 80% of your immune system is in your GI tract. 75% of your neurotransmitters for your brain come from your GI tract. So all of a sudden, gut health is really super important, and the bacteria in your gut are important for all these things. Well, when you have hyperbaric oxygen, you're getting oxygen to places where it doesn't usually go, and you're changing the makeup of bacteria in your GI tract. So all of a sudden now, this hyperbaric oxygen has multiple modalities and things. It can help a whole host of chronic illnesses. And it's interesting because NFL football players have been using this technology for years to prevent the effects of concussions. There's interesting studies looking at football players who've had their own portable hyperbaric chambers, looking at their brains. You see less concussive changes, less damage to the brain in people that are using this. So it's another biohack, another emerging technology. And the thing I tell people is this technology for using pressure for people goes back to the 1600s. So it's not actually new. It's a really old thing that we're rediscovering. And one of the things I've learned in medicine, a lot of things I'm doing, I'm not learning new fancy stuff. I'm just rediscovering old things with new uses. And so that really excites me to rediscover forgotten truths, forgotten information, and then be able to apply it to people. One of the questions a lot of people ask me is, with hyperbaric oxygen, what if I had a concussion 20 years ago? What if I lived in a moldy house 30 years ago? Can hyperbaric oxygen help me today? And I'm gonna take a little rabbit trail down the new information on senescent cells. So what we're learning is that as our cells are flexible, our cells are supposed to be able to switch from a sugar-based metabolism to a glycogen-based metabolism to a fat-based metabolism, which fasting actually stresses that, and that's one of the reasons why fasting is so powerful for your metabolism. But senescent cells are damaged cells that are damaged from a toxin or a chemical, from a nutrient deficiency, from some event, and the cells get stuck in one part of metabolism. So these cells don't die and don't turn over like they're supposed to. They actually live longer than they're supposed to live and get stuck in that metabolism. An extreme version of senescent cells are cancer cells. They get stuck in that part of non-functioning, and then they hypergrow and are hyperinflammatory, and that's an extreme version that most people don't get cancer. But senescent cells are common with mold and Lyme disease, with concussions, with chemical exposures, with trauma and stress. And what happens in our body system, our cells get stuck. And that stuck phase is this inflammatory phase. So you create cytokines, which are inflammatory molecules. In the United States, a lot of people heard about the cytokine storm, with the pandemic and This is not a new concept, but cells that are stuck are more prone to do that kind of stuff. So, well, how do you unstick these cells? And the concussion, the injury, the chemical exposure, the traumatic life event, the PTSD traumatic life event might have been in childhood, been decades ago, and you don't realize the emotional trauma in the moldy house after the tick bite, all of a sudden got these cells in your brain and your heart and your liver stuck in this senescent thing. Well, hyperbaric oxygen unsticks them. Fasting unsticks them. Peptides unstick them. And so what we're realizing now is that this basic cell dysfunction, we have multiple modalities to unstick these cells and help them become less inflammatory and then basically turn over, because all the cells in our body are supposed to turn over and die and be replaced by healthy new cells. What happens in this senescent cell things, they get stuck like that, and hyperbaric oxygen is a powerful tool that actually can unstick these cells decades later. And so like a concussion when you're 12, you play soccer. In the United States, they actually made regulations. Kids can't hit a ball when they're 6 or 8 or 10 years old, right? Because they realized that causes microconcussions and can set those kids up for neurological issues in their 40s. Well, how many people play soccer in our country? How many people have had a concussion when they were a kid? How many people have been hit in the head with a ball? And the answer is like everybody. If you have nutrient deficiencies and omega-3 deficiencies and fatty acid deficiencies and low vitamin D, all of a sudden you're more prone to this senescent stuck cell phenomenon. And all of a sudden some of these biohacks we were talking about and longevity stuff is just getting your cells to go back to normal. And one of the powerful tools of this is hyperbaric oxygen.
I'd like to say something about hyperbaric oxygen therapy. That's when people go inside a hyperbaric oxygen chamber that's pressurized and they put high amounts of oxygen. And when you do that, it saturates all the tissues in the body and in the brain, and it delivers high amounts of oxygen, which is very healing. Hyperbaric oxygen has been used for a long time with head trauma, and we know that head trauma can be a risk for dementia, right? Because you've damaged part of your brain. I had a session in my dementia study group with one of the hyperbaric experts. We call it HBOT, hyperbaric oxygen therapy, HBOT for short. So we had a session with an HBOT therapist who treats NFL football players that have had a lot of head trauma, and also some of the veterans, like with Afghanistan with the blast trauma. And he showed us people's brains that were just a mess, parts of it gone from whatever traumas happened. And then he could show us that tissue coming back with repeated hyperbaric treatments. So it's a very interesting treatment, but there is now data for Alzheimer's disease. There was a case report published out of LSU, and they took a woman with Alzheimer's and they gave her 40 treatments of hyperbaric oxygen, and she got better. But then over a few months, she started to decline again. So they hadn't done a functional medicine approach to remove all the triggers that were driving her dementia. So they gave her 40 more treatments, and she got better again. Now, if you have that kind of response with hyperbaric oxygen, you're going to need to continue it. You may not need to do 40 in a row. You may need to do one a week or one every 2 weeks. You can get on a maintenance schedule. But I think that hyperbaric oxygen therapy is just very healing and anti-aging for all kinds of things. It's really helpful for people that have vascular dementia. So when the lipids are high and the blood sugar is high, it starts destroying our blood vessels. And then that can cause vascular dementia, and the blood vessels start dying in the brain. But hyperbaric oxygen can be another useful treatment modality for that scenario. So I'd like to tell you about one of my patients that is an interesting story. He came to me 5, 6, maybe 7 years ago, and he had Alzheimer's and he had lost his driver's license. And so we worked on the whole functional approach and got things better, and he was so much better that he wanted to go and retest for his driver's license, which he did. And then they gave me a medical form to fill out, and I had to put his diagnosis. And I'm like, oh, what is his diagnosis? Like, he had Alzheimer's, but he's in remission. And that's what I put as a diagnosis, Alzheimer's in remission. Now, nobody had heard of that before, right? Because we've been taught that you can't reverse Alzheimer's, but he had reversed his Alzheimer's, and that's what I put. Now, I just had a visit with that gentleman this last week, and we redid his cognitive testing battery, And he is exactly the same as he was 5 years ago. So he has not only reversed his dementia, but he's maintained that same level of cognitive function over the last 5 years. Because this is the problem with the medications. The ones that we have, they might slow things down a bit, but inevitably you're going to keep declining. So, this whole approach of finding all the root causes and reversing them, we can give enduring change for people.
As you've just heard, there are cases of reversing neurodegenerative diseases thanks to hyperbaric oxygen therapy. What's also helpful in such cases and a bit more controversial is the medicinal use of psychedelics. Certain medicinal plants can work absolute wonders for the mind, even when there's not much hope left. If you've always been a bit skeptical, see how psychedelics can empower patients to deal with extremely bleak situations.
So one of the things I've spoken about is cognitive decline that happens because of trauma in childhood, because of stress and overwhelm in your current day, where you're actually changing the brain architecture. You're shrinking your prefrontal cortex, you're growing your amygdala, your microglia are carving away brain tissue. It's creating Swiss cheese in your brain and you're getting cognitive decline. One of the things that I find really helpful, and this is, you could think of it as cutting edge science, because right now there's so many researchers that are focused on this and so much science being published on it, is using plant medicine for healing the trauma, but also bringing the brain back online. We're finding that synaptic pathways come back together. We know that the brain is neuroplasticity is a subject we've known about for a long time. We know that genetic expression is not in concrete. The way that your genes choose to express themselves is really based on your exposure to toxins, your gut health, and the way that you think. So plant medicine actually helps all of those come together. And when I talk about plant medicine, I'm specifically talking about some of the research that's being done by Johns Hopkins and the University of Wisconsin in Madison, where researchers are looking at lowering death anxiety in patients with cancer using psilocybin. And I find that in my practice with people that have cognitive decline, that have anxiety, that have OCD, that have a lot of different mood issues, as well as autoimmunity, this has become a tool of choice for me if they choose to use it in microdosing as well as in trauma healing sessions. So there's a wide variety of ways and means. You don't just start taking mushrooms. It needs to be done with a proper guide that's trained and can help with the integration process and can track. And then psilocybin by itself is not what's being studied. Psilocybin used in stacked protocols is what's being studied. So it's not just going out and taking mushrooms to have a psychedelic experience.
Speaking to the psychedelic piece and longevity, where I had my own personal experience that I obviously couldn't really talk about in the world out there and didn't talk about. And as I kind of jokingly said earlier, that Michael Pollan kind of brought a lot of people out of the closet to share a little bit more of what we learned. But what I did do for many years prior to talking about it more publicly is I had several patients that were considered terminal hospice patients that did go through the Johns Hopkins psychedelic mushroom trial for end-of-life support. And these were all patients that were given hospice, they were hospice eligible with less than 6 months to live, that were expected to go through this program to help them come to peace with their dying process. And ironically, they were all stage 4 ovarian. So there was that resonance of my background and my history. And that's why they trusted me to look into this what seemed like a terrifying experience for them. But because it was in a clinical trial at Hopkins, they felt somehow that gave it some credibility and validity. And all of those women are still here today. And one of them is 12, 13 years out at this point. And it was that same experience that I had, that it helped them see another way in their life. And so that is a very powerful tool that can support a longevity experience with someone's really, really stuck. And so not to go out and say everyone rush off and do this, but the studies, the research is compelling in the end of life genre, incredibly so.
I'm sure the personal experience from Dr. Nasha Winters made you reconsider the medical properties of psychedelics. It's hard to believe, but we've come to the end of the Ageless docuseries. Throughout these 12 episodes, you've heard how many tools are out there, and they can all help you live a longer, better, and healthier life. I'm confident you've learned a lot, and thanks to our amazing experts, you've opened your eyes to a whole range of possibilities available to you. Whether that's prevention, diagnosing, or healing, you simply know more and you know you are not powerless. But knowledge is just the first step. Now it's time to put that knowledge into practice. This is the only real way to become ageless. And remember, you have all the support you need to succeed. 12 episodes of Ageless at your disposal anytime, with over 1,000 health bites in short format across 40 different shows that you can start watching right now. Over 150 doctors and health experts from Zonia, like those in the Ageless docuseries, share their very best tips and techniques to reverse premature aging, tackle diseases, lose weight, and get back on track with your mood, sleep, nutrition, and anything you need to transform your health and improve your longevity. So now is the perfect time to get started. Join Zonia today and make the commitment to become the best version of yourself, happy, energetic, and confident. The person who looks in the mirror without regret. Also, this is our final bonus episode, which means we are closing the doors to the Ageless docuseries inside our platform very soon. And one last friendly reminder that we have decided to add over $2,763 worth of free essential bonuses to our Zonia platform for everyone who joins Zonia during this free screening of this bonus episode only. First, a friendly reminder that if you choose the annual Zonia plan, you'll receive our all-natural herbal longevity and detox supplement bundle for absolutely free. This bundle includes one bottle of our Restore Life Longevity Supplement, our fastest body rejuvenation formula with the power of 7 natural ingredients, plus one bottle of our Restore Detox Supplement that has 6 science-backed herbal ingredients which can help you flush out dangerous age-accelerating toxins, which, as you discovered in this episode, is super important for healthy longevity. Both supplements are worth $158, which is more than the annual plan for Zonia itself, and you'll get them for free together with all other bonuses. These bonuses include downloadable PDF transcripts and MP3 audios of all 12 episodes of Ageless, so you can read or listen offline each episode anytime and anywhere you want. Plus, you'll receive 50 full-length, uncut, uncensored interviews with all 50 doctors and health experts of our Ageless docuseries. You'll receive on-demand video access to all of them, plus, again, downloadable PDF transcripts and MP3 audios of all interviews. In addition, you'll get access to 3 longevity interviews with 3 healthy non-Nigerians and their secrets. You'll also get over $1,500 worth of extra free bonuses from our trusted health partners. The total value of all these bonuses comes down to $2,763, but you'll get all these bonuses for free, plus on-demand access to all 12 episodes of Ageless if you join Zonia today for as low as 50 cents a day. This special offer is available only during the free screening of this bonus episode that ends in less than 24 hours. This means if you decide to join Zonia after this free special screening, you'll still have access to over 1,000 short health bite-sized videos on Zonia. However, you'll not only lose the chance to get over $2,763 worth of free essential bonuses, but all 12 episodes of the Ageless docuseries will be gone from Zonia for all new members who join after this free screening. So don't wait. Time is flying and you don't want to miss out on this opportunity to join Zonia today. And as always, we would love to hear from you, so please let us know what you think of this docuseries by leaving a comment in the section below. Thank you so much for watching all 12 episodes of Ageless. I encourage you to never stop searching for the truth about our health, our happiness, and our lives. In a fast-changing world, we sometimes forget the basic principles of life. And I hope this docu-series added to your perspective on how much power each one of us has to make the best of our time here. I look forward to seeing you in future docu-series. Till then, keep taking care of your health and live life to the fullest. Cheers, my friend.